So both my parents are physiotherapists, so I've always known that I wanted to do something in healthcare, but I didn't want to do something so typical as what they do. It's when I was looking on NHS jobs, I had a little search around, and as soon as I found Cardiac Physiology on that website, I knew it was something that I wanted to do. It's a really new career, people are going into it, and there's all these new devices that are constantly being advanced. So I think what I loved about it is the fact that there was so much progression, and there's so much 21st century advancement in it. I loved the idea of working in the NHS, wanting to help people and give back. But what I absolutely loved about it was how many specialisms they had. So you could go into a sporting aspect of it, into echocardiograms, into pacing, cath labs. Such an exciting career. You're dealing with patients at such a critical point in their lives, and I think it's just so exciting and so kind of riveting as to where you can go with it. I absolutely loved how it was an up-and-coming city. There was so much opportunity, but I also loved the university itself. I love how everything's situated around a campus. I love the campus universities, and I think the way they structured our course as well was very good, and the fact that we get the best of both worlds, that we do placements so many days a week, but then we also get that uni lifestyle of coming in and doing lectures also. I think for a cardiac physiologist, you just need to be able to have good people skills. You're dealing with people at quite a critical point in their lives where they're struggling, they don't quite understand what's going on. There's a lot of people around them that are fussing over them. So I just think you need to have really good people skills and be able to calm people down in that instance, be able to hold a hand. You also need to be able to have quite a good kind of passion for healthcare and for caring of elderly. You've got to also be able to be quite logical. A lot of the situations that we face in pacing are like a problem-solving kind of routine. Be able to kind of logistically look at a problem face on. So we use technology in the form of ECGs, so we'll stick electrodes on people's chests and we'll get to look at their heart rate and rhythm. We can also do that with ear pacemakers, and we've also got internal defibrillators as well, which we are using more. So these are all to check heart rates and rhythms and be able to correct these also. And when we're looking at a pacemaker, so a patient will come every year to have a look at whether the device is functioning properly, and we'll get a set of figures and a set of data to look at, and we need to be able to spot, is there anything that the pacemaker's not doing right? From those figures, we need to be able to troubleshoot and think, okay, so if this figure's not right, what do we do to fix it? And we'll try a variety of things to be able to make sure that that patient's feeling comfortable with their pacemaker and that pacemaker's reliable. I think we're able to really calm patients' nerves when they're coming for their pacemaker checks. Often they have quite a lot of worry as that the pacemaker's doing all the work for them, that their heart's not functioning properly. So to be able to just be able to calm their nerves down, inform them what exactly the pacemaker does and what its function is, and just to be able to listen to that patient and any symptoms that they're having to be able to help resolve them also. Quite a lot of the conditions that we're facing with, we aren't able to cure them, it's all about management. So I think we really need to be able to have some empathy with the patient and the struggles that they're going through. It's not an easy thing to accept that you've got a congenital heart disease, coronary artery disease, the list goes on. So I think just being able to kind of put yourself in that patient's shoes so you can really empathise with that patient. I remember having a pulmonary fibrosis patient, which is quite a terminal case, and he was really getting short of breath and he was getting quite panicked at the idea when he was first diagnosed. And just to help calm him down, I mentioned that he used to be a runner, and that was something that I was also quite passionate about. And we just had a little 5-minute interaction of trying to speak about what races he's done, what his times were. And all of a sudden his shortness of breath had kind of relaxed, and he just seemed so kind of more happy and more at ease to be able to discuss the issues then about his care and his kind of end-of-life plan. I think at the time, it is quite, it pulls at your heartstrings a bit. But I think it was really nice for me to see how much of an impact I had on that patient, not by treating them with any medication, not by doing anything kind of medically, but just being able to see what impact of words could have and just being that caring hand that could just speak to that patient. I think it's a vital part of the role. I think people focus too quickly on just being able to solve the problem and that's it, out the door. But I think massively what I enjoy is being able to speak with that patient. There's somebody that's, has a daughter, has sons, their mothers. So just being able to kind of put that patient into a setting where you can think of them as not a case study, but as somebody that, really needs urgent care, and you can hold their hand and guide them through that. I think placement is the vital part of the course. I think you learn all the theory as at university, but I think you don't properly understand that until you get to put them into an actual clinical scenario. I've learned so much more on placement, and I've been at such a variety of hospitals where you're just thrown into different scenarios that you might not be prepared for. And it's not all about getting it right all the time, but it's just being able to kind of just build on experience and being able to just sit there with other physiologists and discuss, have they been through similar situations? It's really quite daunting, and I think you kind of expect that you need to know everything and they're going to quiz you. But when I went there, everybody's so welcoming, everybody's been through that process also. A lot of them at Leeds as well, so it's really nice to see that they've been through a similar process and have got to where they are. It was so nice my first day just to feel at ease and be welcomed so much into that department. I'm currently a third year student, so obviously my main focus this year was to be able to start looking for some jobs. So I was constantly looking at the NHS website and recently did attend an interview and got a job at York, which was my first placement. So I'm really pleased to be looking forward to that next year. So we had a module this year that allowed us to do some mock interviews, prepare mock applications. So I think the university have prepared us really well to make that jump from being a student, so supernumerary, to being able to be a responsible cardiac physiologist. So we've had people from companies that provide pacemakers come in and give us talks to kind of see how it's developing, what's the research behind current techniques, current treatments. I think they start really well with this. You obviously start at the basics and you build upon that each year, so you're constantly recapping and going back to those core values of the job.